Hello, I'm Robert, a fact checker and science blog and helping people who are scared of many things. Welcome to my channel. So this time it's about the really rather good news from United States that the cases per day are falling really rather fast. That's about a third drop from January the 7th to it's about 2 weeks. And the deaths are still rising, but you always have a long lag for that. Hospitalizations are already falling. Not only that though, every single state has decreasing cases per day. That's such a difference from a while back. You see, many of them were increasing just a few weeks ago. Increasing hugely, and now they're falling. So that's wonderful news. And then I tend to follow it on this chart here, which shows the infection rate. And the infection rate is currently, the worst state is Virginia. It varies which is the worst state. And that's 0.97. That means if you've got 100 infected, they infect 97, which then infect 95 or so, and then less and less and less. And eventually it's going to fade away, and eventually there'll be nobody left infected. If you go and look at Tennessee, and that's 0.75, so that's 3/4, then you get 3/4 of 3/4, and so on and so on. If you look at the metro areas, no, not metro areas, the counties, then the best one is this one, and it's got 0.3. So if you can get down to 0.3 for your infection rate, that means 100 people infect 30, which infect 10, which infect 3, which infect 1, and then it's gone. So even if you've got a big outbreak of 100 cases, then it'll fizzle out. And that's why the disease just can't go very far. Once you've got an infection rate as low as 0.3, then all the little infections that arise soon just go out. If you get an infection rate of 0.3, then the virus will be gone completely from your state if you can keep that up for long enough. Indeed, any infection rate below 1, but you have to be very patient if it's quite close to 1. If it's down to 0.3, it'll happen quickly. And New Zealand, they had an infection rate of 0.4. So this is not just a quirk, this can happen. The United States can achieve it. Sadly, at the moment, the worst metropolitan area has an infection rate of nearly 2. There's no reason why those can't all end up being not just less than 1, they could all go down to less than a half of the counties. There's no reason why these can't all be down in this range, less than a half. And if we do that, then it will reduce very quickly. Now, people worry about the new variants. Well, the new variants can be controlled in the same way. And here is Maria Van Kerkhove, who's the head of the COVID-19 unit for the World Health Organization. And they're having a conference about this and a guidelines development group. And so she's saying, I continue to be encouraged by declining incidence in countries where these variants are circulating. So look, for instance, United Kingdom, it's declining. These are cases per day. It'll be a while before we notice the effect on the hospitalizations and then the deaths, but they're reducing quickly. And this is not because of the vaccine. The vaccine is not yet had enough people vaccinated to notice significantly reduced for the total of all the infections. So, and then add the vaccines as well, and the vaccines will mean 1/10 of that if for the most effective. And yes, so I just want to explain, as one of the things that they're actually meeting, the guidelines development group, one of the things they're looking at right now are guidelines on how to change the spike on the vaccine. So you've heard of this protein spike, and many of the vaccines use that protein spike. And they are designed in such a way, with modern science, miracles of modern science, they can swap out one spike with another. So that surely doesn't need a full phase 3 trial to check again with a new spike, when all you've done is just change the spike slightly. So the World Health Organization are working out what are the guidelines, what are the basis, in what sort of way, what procedures do you have to do to change the spike. And they hope that they're talking about possibility of changing the spike over a matter of weeks. So then you could use that either for the second shot, or you could use that for a booster shot. And so if you've got you've got the antibodies of the first spike, and then your booster shot could be a second spike, and then you have antibodies to both of them. And that might be a way, for instance, if you've got two variants circulating, then you could have antibodies to both by having a different vaccine for each spike, for first dose and the booster dose, for instance. Anyway, we will see what they decide with their guidelines and what they say is permitted, and what they think is scientifically valid. Now, I just want to talk a little bit about following the science. So so everything's looking very good. The reason it's going down so quickly, and that's Tennessee. One of us 0.75. That's why it's what a 0.75 state looks like. It's falling down very fast. A 0.4 state, once we get to the point where some of them get down to 0.4 for the entire state, not just the county, that would be much faster. It would be down like there by then. That's what New Zealand did, that's what Wuhan did, and that's what South Korea did. So it's not, and then the new variants, there seems no reason why we can't have the new variants going down as fast as that. Now, if we have a vaccine, then it seems pretty certain that from the AstraZeneca early results, even reducing the total number of cases, including asymptomatic, then with the right regime, with their long gap between the two, they reduced them by 56%. So now, if you have even a 50% effective vaccine, then that 0.3 becomes 0.15. The 0.75 for Tennessee becomes 0.375, and so that would be better than New Zealand did, because if you've got a vaccine that halves the transmission, that halves it. That goes on top of whatever other things you're doing, so long as you keep those up as well. So the vaccine, even if it's not even that good at stopping transmission, because 50% isn't that good, even so, a 50% but it's good enough to be combined with everything else to mean we eliminate it, and we can end it. If that number stays below 1, then the virus can be completely eliminated, like New Zealand did. And then the reasons to think that the vaccines, that the vaccinated asymptomatic, then for flu it's half as infectious if you're asymptomatic than if you're symptomatic. But for COVID-19 it's more like 20 times less infectious if you're asymptomatic. They're not really sure why. But asymptomatic people are much less infectious. That is quite promising for the vaccine. So I personally, the experts are reluctant to commit on this because they will have their words said against them later on if the vaccine turns out not to be very effective at stopping transmission. But I can hypothesize as someone who's not going to, nobody expects me to be right upon this. And so I'm just very optimistic. I think there's a good chance that someone who just reads the literature but who's not, not an expert, then I think it's a good chance that the vaccines will be very good at stopping transmission. So there's certainly plenty of reason to be optimistic here. And so, and then just want to say, this is where's the thing? This is what it looks like if you don't follow the science. This is what it looks like if you do follow the science. And that it's very, very striking difference between what happened under Trump and what happened under Biden. And Biden already was a big influence by then, because Trump was just stopped talking about it. And This is nothing to do with Biden being right-wing. If he'd been a right-wing president who follows the science, then he would have kept it. This would never have happened. He would have gone way, way, way down like that, and then he would have been re-elected. I think there's little doubt that if Trump had followed the science like Biden is doing, then he would be serving a second term. Whatever you think about his politics, and this is because presidents or prime ministers who end the pandemic get a huge boost in popularity, as we saw with New Zealand with the landslide and President Moon in South Korea. So it's just not following the science, and we have the same in the United Kingdom with Boris Johnson, and it's nothing to do with being right wing. If we had had Maggie Thatcher, who is very right wing Prime Minister in the United Kingdom, she was trained as a scientist. I think there's no doubt that under Maggie Thatcher we would have ended this very fast. And the Iron Maiden, she would have been very strict and rigorous in following the science. She was first to bring, and I'm no fan of her politics. I'm rather centrist, somewhat to the left. She's very right. I'm not a fan of her political views in the United Kingdom, but as a scientist, then she was a scientific prime minister, and she was the first leader on the world stage to speak up about climate change in the late 1980s, 30 years ago. She was saying we've got to do something about this urgently 30 years ago. And she would be on this in January, February. As soon as she heard about Wuhan, she'd been following all the scientific research, and I believe that she would have been as on the ball as Taiwan was, which never even had to do a lockdown. So if we'd been as on the ball as Taiwan has had an epidemiologist as the second in command of the government. I forget his rank, what he was called, and Taiwan responded very quickly. And I think the reason that people say, oh, China did it because they're authoritarian. No, China did it because of previous experience of SARS. In 20 years ago, 2002 to 3, China did an appalling job of it with SARS. And they were really very slow, months late. They're just very, very lucky. If China in 2002 or 3 had been faced with COVID, they would have they wouldn't have known what hit them. So I think the main reason that China was so successful was because of previous experience with SARS. I think there's no doubt about that. If they hadn't had SARS in 2002 to 3, then they would have been as badly hit as anyone. And then the reason is because of the epidemiologists and the doctors in China. They'd learnt the lesson from SARS, so had Taiwan. Taiwan was so fast. And I think if this was explained, if people understood that was why China was so fast, and that it's because of their medical staff there, it's nothing to do. I personally don't think it's anything much to do with authoritarian government. It's to do with people taking it seriously. And we could have done the same in Europe as they did in China, if we'd taken it as seriously. And I think it's because we hadn't got previous experience of such a severe respiratory disease as SARS that can be stopped with test, trace, isolate. And I think that's pretty much the entire reason that we have had such a lax response. And we are gradually learning. But it took China a long time to learn and get its lessons for SARS. And we're having to learn this very quickly on the ball with a really much more serious, much more severe disease, and learn it much faster than China did. That's my take on it. I think that if people understand it that way, then it just takes away all this sort of thing about, oh, they're a communist country. It wasn't because they were communist. Because the medical teams there, and the doctors and the epidemiologists and the general public understood the seriousness and were really on the ball. And that's why China stopped it so quickly in Wuhan. And they were so on the ball that by mid-February, and this is long before lots of advances since then, we haven't yet achieved this in the United Kingdom or the United States. They got two things they did that made a huge difference to how fast they brought it down, better than New Zealand, better than anyone. And that is, for number one, they got the turnaround time for the PCR tests to 4 hours. 4 hours. That is literally about as fast as you can do a PCR test. If you went into hospital and they got the time that it took to from first onset of symptoms to people reporting to the hospital to 2 days. So they educated the public, very clear communication to the public. People knew what to look out for. They were advised to go to hospital even for the mildest symptoms that could be COVID. They would get to the hospital, they would be pre-screened, and then if they decide it could be COVID, they then go to get COVID tested, and then when they get COVID tested, then they got the test results back 4 hours later. They just waited in the hospital for 4 hours, and they got their result back, positive or not. And then if it was positive, the next thing that China did is that you wouldn't go home if you got a positive test. You would go to a special ward, or in one of the big stadiums, a ward for mild cases. And that's the World Health Organization's advice is still that mild cases should be looked after in hospital wards if you possibly can, and isolated in a ward looked after by experts. Even if it's a completely mild case, they have to be isolated, and that protects your family. Now, if you can't isolate in a ward, then you isolate in something like a stadium or a community centre or hotels. If you can't isolate in those either, then very reluctantly you isolate at home, and you have a health worker come and advise you how to isolate. And then they ring up every day to check how you're doing. And if you can't do that, that's where we are in the United Kingdom. We are the lowest of the lowest of the low when it comes to isolation and quarantine. And people need to understand the importance of testing. You test in order to isolate. That's why you test. That's why you test. People need to understand that. And you isolate to protect your own family. So, people don't realise how easy, what a big difference it makes, how you can protect your family by isolating, and you can't do it so effectively with flu. So this was communicated very clearly to the public in China, and they understood this, what I've just explained to you, which most people, in my experience, in the United Kingdom don't understand this yet. And they knew that in China, and they looked just bemused at the rest of the world. Why aren't these people doing this? Why are they isolating at home? Why aren't they getting tested quickly? Why aren't people disclosing their contacts? It's no wonder that we're not managing to control it, and so quickly as China. And so we have to do all that. We have to keep doing these things. We've got to do the physical distancing. We've got to do everything, and then the vaccine will help with our really rather appalling response. But it's not. It's in a way I don't really want to point blame. I'm not blaming anyone. It's just we haven't got the physical memory. We haven't got the experience of it, and sadly, we have these politicians who argued politics with the virus, and that is not because they are bad people. It is because they don't understand. They have never had to deal with something like this before, and they haven't yet understood the importance of the science. And then Biden, he's not a scientist either, but for some reason, Biden, like Joe Biden, like Jacinda Ardern, just for some reason, they have an appreciation of that science works, and they understand the science, and that's what they've got going for them. They're not scientists, but they understand how science works. And one of the things about science is that you need to go by, don't choose a pet scientist who says something that you like. You need to go by the science, which means a systematic review means that they do a systematic review means they go by the methods. They check all the research by the methods, and then whatever the conclusions are for properly conducted, the best conducted research, that's what you go by. You don't go by whether you like the conclusions. You don't go by whether you like the conclusions. That's the most important thing. And you don't go by whether it fits your intuition, the conclusions. Because scientists too can have very bad intuitions because they are used to some different thing. You go by what the science says, which is often unintuitive. It's often counter what you expected. So when the team visited Wuhan, they discovered that China was controlling it in this way, and this was very counterintuitive because they'd never seen a respiratory disease controlled in this way, not a big pandemic type one like this. And they just were absolutely amazed by it. But they checked carefully, and that's what was happening. So that's what following the science is about. It's about checking the proper, rigorous science and looking at it properly. Anyway, so I think this is just looking so positive, so many reasons to be optimistic. And then there's the vaccination, so we've got, these are just the vast numbers of vaccines. We're going to look how it's going to increase from these are the first and second quarters, second halves of 2021, this is 2022, and that's 2023. And we can easily vaccinate everyone. We've got more than 50% of the world's population worth of vaccines pre-ordered already. Companies have said they'll make them, and quite a few of them, and quite a bit already being made, and all the capabilities, the factories being built, and so on, or being upgraded to do it. And if we really put ourselves behind this, I think we can vaccinate everyone in the world who wants to be vaccinated by the end of 2021, certainly by 2022. And this has never happened before with any disease before, and we have several other diseases that we could end in a year. If having learnt to do that and got the muscle memory in the entire world to do that, we could then say, okay, this year we'll get rid of mumps, and at the end of that year, no longer any mumps in the world. This year, we're going to get rid of rubella. This year, we're going to get rid of measles. And even maybe do several diseases in the same year. We could get to the end of by 2030, and we could have a half dozen more diseases that are just completely gone from the world. Having first done it with COVID, then people will certainly be asking, then why do we have these other diseases that can be stopped measles can be stopped much more easily than COVID if you vaccinate enough people, because it is, well, we don't know. The vaccines for COVID may work as well as the measles vaccine because it's got a much lower natural R naught. So it is possible that our vaccines work as well for COVID as they do for measles. We know we've got a very effective vaccine for measles, and if it could be eradicated from the world, we could have eradicated from the world years ago. We could have eradicated polio from the world decades ago if we had had as much interest in eradicating polio as we have today for COVID. Then the main reason that it is not eradicated is because they had to use the lower cost vaccine for most of the world, which had this side effect, very sad side effect, that after going through someone's digestion system, it can reactivate. And that is why we still have COVID today, still have polio today. So anyway, we can get rid of polio now. Next year we could get rid of polio in a year as well, with this sort of effort. And we can be rid of many diseases by 2030. It's a long, long list of diseases that we can totally eradicate, even just by putting the same amount of effort that we put for COVID, which once we've got the vaccine, we've already got the vaccines for these other diseases. We don't need to have all that effort for the vaccines. All we need to do is to have the same amount of effort of vaccinating everyone. Some of them have already been eradicated as native diseases from the Americas, and it really wouldn't be that expensive even. So it just needs us to decide as a world that we want to eradicate mumps or something, and then we can be rid of it. And that is what this is showing to the world. And so anyway, so things are looking very good, not just for COVID, but for strengthening our health systems. So the reason China's health system is so strong is because of SARS. And the results of COVID will help the rest of the world to have a much stronger health system for future pandemics. And then we've also learned to work together in ways that we've never worked together before. And also huge improvements. For instance, the World Health Organization talk about how they're doing these huge Zoom chats around the world. And they're doing things, it used to be that they'd have organized a conference together, and several weeks together later they'd all meet. Now they're having these huge Zoom chats, and they've learned how to do it, and they've changed the way they do things. And the science is progressing so much faster as a result of doing that. And so that is something we're not going to lose. Science, the rate of progress of medical science. We have developed new ways of doing things, which means that we can develop medical science much faster. We have much more support for developing drugs and developing vaccines going into the future. People understand now, see it works. And there's a lot more interest now in this sort of thing. Go back to 2019, and people would vaguely know that hundreds of thousands of people are dying of certain diseases in the world, and some people wouldn't even know that. And there just is well, that's the way the world's always been kind of attitude to it, a kind of world-weary attitude. And that is not the way people think anymore. We are much more can-do attitude to public health and to diseases now. And that is a positive thing that's coming from COVID. So I think this is part, I think from the future, this year, very painful, very awful thing. But I think this is the year in which we are starting to mature as a civilization, in learning to work together and learning how things that happen in some completely different parts in the Amazon, in a town in the Amazon, a variant evolving in a city in the Amazon, is something that the whole world should care about. And it matters to the entire world that they have good health care there, which sadly they don't. So I see things very positive going on here. Right, I'll upload this. Sorry, if you, I did several takes of this because my first time around, some things didn't come out quite well. So I've unlisted one of them, so hopefully that would be less confusing. I'll do this one as a slightly shorter one. You can watch the other take if you want. It says things slightly differently. But yes, this was quite a difficult one to present because there's so many pieces of the jigsaw puzzle to come together, and there was various digressions that I got involved in, which I've managed to avoid this time. So anyway, I'll upload it. I think in half an hour this is about right. Just give you a shout out for our group, for my channel of course, do subscribe and do like and subscribe as they usually say. But our Facebook group Doomsday Debunked, we especially welcome people who are knowledgeable about these things that people get scared of, and then also the people who are very scared, and people who know how to go to the best, most reliable sources. Like for instance for COVID, the best sources are the World Health Organization, the US CDC. I would say those are the two top best world sources of good information on COVID. And so you get to know what are the good sources, and then if you on COVID, do watch the social media Q/A every Wednesday, and the press briefings if you're more techie. Then you can listen to those on Mondays and Fridays. The social media Q/A are the general public asking questions. The other two are journalists, and they tend to be a little bit political and sometimes a bit techy. So they're quite a long listen as well. So I've listened to all the press briefings and all the Q/As, but the Q/As are an easier listen for the general public, because they answer questions from the general public. They will typically are answering questions about whatever is on your mind. There was an excellent one last Wednesday about variance, for instance. So anyway, I'll stop now and upload this video.